Does anemia run in your family? It could be something inherited called as spherocytosis. If someone had jaundice, gallstones, anemia, the problem may actually begin the red blood cells. What if your red blood cells are breaking too early because of their shape? Yes, because of their shape. They are more rounded than they should be. Let's talk about spherocytosis. Tiredness, yellow eyes, enlarged spleen, gallstones. These may all be connected by one blood disorder. Hello everybody, I'm Dr. PK and today we are talking about spherocytosis. Yesterday I have a patient in mid-30s, a female, first time here in the clinic with a history of a splenectomy and she's planning to start her family. And so that got me doing this video. The condition is called hereditary spherocytosis. It's an autosomal dominant condition. This is a blood disorder where red blood cells are shaped abnormally and break down earlier than normal. So normally the lifespan of red blood cells is 120 days, but patient with spherocytosis, it's much shorter. I'm going to talk about that. So normally red blood cells are soft, flexible, and shaped like a disc. Yes, they're shaped like a disc. This kind of shape helps them squeeze through tiny blood vessels and survive about 120 days. But in hereditary spherocytosis, red blood cells become more rounder, smaller, and less flexible. And because of that, they're less flexible. They get trapped in a spleen, and the spleen destroys them too early, and the spleen becomes bigger and bigger. The result is anemia, jaundice, fatigue, enlarged spleen, and gallstones sometimes. So it's an inherited condition, it runs in families, and it happens because of defects in protein that support red blood cell membrane. When these proteins do not work properly, the cell membranes become unstable and red blood cells loses part of its surface and becomes more like a sphere instead of a disc. A spherical cell cannot bend easily, so the spleen recognizes it as an abnormal and removes it from the circulation. And this causes what we call hemolytic anemia, which means anemia due to premature destruction of red blood cells by spleen. Some people have mild form and live many years without any symptoms, maybe with only minor symptoms. Others have moderate or severe disease, especially in childhood. Symptoms can vary a lot from person to person. Some people are diagnosed as children, others are not diagnosed until adulthood. Common symptoms are fatigue, weakness, pale skin, jaundice, meaning yellowing of the eyes or skin, dark urine in some cases, shortness of breath with exertion, rapid heartbeat, enlarged spleen, which may cause discomfort or fullness in the left upper abdomen. Over time, spherocytosis can lead to pigmented gallstones because the body is breaking down red blood cells faster than normal, producing more bilirubin. In children, it presents as anemia, jaundice, poor feeding, and enlarged spleen. Sometimes condition can get worse temporarily during infection and it can cause hemolytic crisis. Rarely a viral infection like parvovirus B19 can cause aplastic crisis where the bone marrow temporarily stops making enough red blood cells, and that can become serious and needs urgent care. How do you diagnose? Complete blood count. This will show low hemoglobin and meaning there's anemia, sometimes increased MCHC, which can be a clue. Reticulocyte count may be high because bone marrow is trying to produce more and more red blood cells to compensate early destruction of red blood cells. Peripheral blood smear, on the slide, this is a very important. Under the microscope, the labs may see spherocytes, which are round red blood cells without the normal central pale area. Bilirubin and LDH goes up because of destruction of red blood cells. Haptoglobin will be low because this protein is used up when red blood cells break down. Reticount, called reticulocyte count, goes up, showing the bone marrow is working harder to replace destroyed cells. They have a specialized confirmatory test. One is called EMA binding test by flow cytometry, which is very helpful. And then there's an osmotic fragility test. Coombs test is important because it helps distinguish hereditary spherocytosis from autoimmune hemolytic anemia. Coombs test is usually negative in spherocytosis. Ultrasound to check out the spleen and gallstone. And management and treatment. Many patients are given folic acid supplement because bone marrow is consistently working harder than normal to make red blood cells, and folic acid is important for DNA synthesis. Monitoring. People with mild disease, periodic blood test, monitoring for anemia, jaundice, blood transfusion, especially in children and those having crisis, they may need blood transfusion. Splenectomy. This lady had a splenectomy done when she was in her teens. In moderate to severe cases, one major treatment is a splenectomy, which means removal of the spleen. Since the spleen is the main place where these abnormal red blood cells are destroyed, removing it can greatly reduce hemolysis and improve anemia. But a splenectomy is not a simple decision. A spleen helps protect certain infections, so removing it increases infection risk. That is why doctors carefully weigh the risk and benefits. Before a splenectomy, patients usually need proper vaccination, counseling about infection risk. Cholecystectomy, if gallstone becomes symptomatic, patient may need removal of gallbladder. Now, avoiding complication, patients should know the warning sign of worsening anemia, severe fatigue, infection, jaundice, abdominal pain from gallstone, sudden drop in blood counts during viral illness. So, let's summarize. Hereditary spherocytosis, inherited disorder, autosomal dominant, red blood cell membrane issues, cells become round, fragile, get destroyed easily, eaten up by spleen, can cause anemia, jaundice, enlarged spleen, gallstone, diagnosis by complete blood count, retic count, bilirubin level, hemolysis, lab parameters, blood smear showing spherocytes, Coombs test negative, confirmatory tests like EMA binding or osmotic fragility testing, treatment folic acid monitoring, transfusion as needed, splenectomy in selected cases, gallbladder removal if symptomatic gallstone. So, thank you for watching. Please like, share, and repost, and subscribe to Dr. PK Live. Have a great day.